What if people started removing their investment from health insurance companies specifically? So I've had this question for a while since the whole Luigi thing. And so I asked ChatGPT, they have these agents, these new things that you can like. It makes a whole video showing it do its process and it looks for stuff. So I basically asked it, what would happen economically if people started removing all of their investment from health insurance companies? Or if you could get a large amount of people to do that. My theory is that if you could get a lot of people to do that, that it would change the behavior of the healthcare industry and make it better for people. But I'm not sure. So anyway, I asked it and it did all of its stuff. And then it gave me this whole thing here. And I'm going to be honest, it's a little wordy, legitimately a scientific paper. So then I said, dumb it down for me a little bit. And then this right here makes sense. Imagine the health insurance companies are big clubs that people pay money to each month. Then if someone gets sick or hurt, the club helps pay for the doctor's medicine or hospitals, which they haven't been doing apparently, right? Lots of grown-ups have jobs at these clubs. So these clubs, these health insurance companies employ a lot of people. Now imagine people decide they don't want to support these clubs anymore and take their money away. Here's what might happen. Number one, clubs lose money. With less money, clubs might have trouble helping people pay for their doctor's visits. I imagine that, right, would again encourage them to change, I don't know, their behavior, right, to like, get more people to have insurance if people started leaving. But see, this is also talking about people removing, almost just changing insurance pretty much. In effect, that's what it's doing, I guess. Because people would still want insurance, presumably. They would just want one that's known for being better, with a better reputation. Ooh, a healthcare credit score. Oh, we should do a healthcare credit score, right? And then if the credit score of the healthcare place is bad, then just don't even talk to them. Jobs go away. Since the clubs have less money, some people working there might lose their jobs. Without jobs, these workers can't buy as many things like toys or food, which hurts the stores where they shop. I get that, but how many jobs? I know it's not going to be like 1,000, right? That would be the, of course, cut it number, but what's the number? What's the limit of where we would say it's worth saving? And that makes me think, how far deeply rooted into everything really is it? What jobs count as healthcare? Insurance jobs. Doctor visits cost more. The clubs might have to ask people to pay more money each month, or doctors and hospitals might become more expensive. I get why they would need to make them pay more each month because they want to recoup what they've lost, but doctors and hospitals might become more expensive. Why? Because what does the insurance thing have to do with what the doctors and hospitals charge? How would the insurance company losing money make the doctor visit cost more? New ideas could help. If the clubs become too weak, the government might step in and create one big new club for everyone. This could help make things easier and cheaper for people because one big club can do things more simply than many small clubs. Didn't they do that? Didn't the government do that? Am I tripping? I'm not sure. I think that's healthcare.gov, right? Or is that just a place where they hook you up with insurances? So if lots of money pull money away from these health clubs, it could cause some problems at first, like job losses and higher costs. But if everyone works together, that's going to happen, to create one big, fairer club, it might make things better in the end. Ain't too greedy. People ain't going to do that. People are greedy. So I have these questions. How many jobs might have been lost? How many people are employed in health insurance system, not including professionals like doctors? And then how would that make doctors and hospitals cost more? All right, let's see what it says to these questions. How many jobs might be lost? Right now, around 3 million people work in the insurance business, and about 590,000 of those specifically work in health insurance. These are office jobs, customer service, IT, etc., doctors or nurses. If health insurance companies suddenly lose money, thousands and even tens of thousands of those workers might lose jobs. If the whole system changed drastically, a large number of the 590,000 jobs could be at risk. Is that a large, what percentage is that of people, I wonder? Why would doctors and hospitals cost more? Health insurance companies usually help keep prices lower because they negotiate deals with hospitals and doctors to pay lower prices. So is this like the people who are in network and whatnot? They double check bills to make sure people aren't charged too much. Do they encourage people to get cheaper and better care early instead of expensive care later? When has it ever incurred? What? When? It still cost an arm and a leg just to go get a checkup. What are you even talking about? This is ridiculous. If these insurance companies become weaker and go away without a good replacement, doctors and hospitals would not have to negotiate lower prices as often and might start charging more. This would make healthcare more expensive overall. So is this what happened back in the day, and that's why insurance was kind of like, you've only got two hospitals to choose from in your area, and you're going to be like, well, it costs a little bit more because we need to operate. If the insurance companies were replaced by one big organization like a government providing healthcare directly, prices might actually go down because it's simpler and cheaper for one big group to handle negotiation and paperwork than many small ones. As long as it's good, look, I'm all up for making it cheaper just for one big one, like fine. I could be something I'm not seeing, and that would be bad. But to sum up simply, about 590,000 jobs are directly tied to health insurance. Losing investment insurance could threaten these jobs. Without insurance companies negotiating lower prices, hospitals and doctors could become more expensive. But if a well-organized system replaced these companies, costs could actually become lower. Here's the thing. I'm wondering, isn't that Obamacare? I would say, isn't that Obamacare? I think that's what that is, right? You're on the right track, but it's a little different. Obamacare, also called Affordable Care Act, isn't a single government-run insurance system. Instead, it makes rules so insurance companies can't charge too much or refuse to help people who are sick. Helps more people afford insurance by giving them extra money called subsidies. Encourages states to let more people join programs like Medicaid, which is a health program for people who don't have a lot of money. But Obamacare still uses private health insurance companies. Like I said, it's a place like an aggregate or something. The government doesn't take over completely. It just sets rules to help people get insurance. A single payer system, what we talked about earlier, would be very different from Obamacare. In a single payer system, someone gets their insurance from one big club, usually run by the government. This makes things simpler and can lower prices because there's only one group negotiating with doctors and hospitals instead of many separate companies. So Obamacare isn't the same. Okay, so why don't we do that? Wait, so is that what happens in like the UK? Like that what universal basic healthcare is or whatever? What people often call free healthcare in other countries is usually a high payer healthcare system or something very close to it. It means the government collects taxes and then uses the money to pay doctors, hospitals, and medicine directly. People don't get medical bills when they go to the doctor or hospital because their taxes already cover the cost. All right, different countries that have it. Canada has a single payer system where the government pays doctors and hospitals directly and people don't get medical bills. UK has National Health Service, which is similar and covers nearly all healthcare through taxes. Australia uses taxes to pay for healthcare costs through a system called Medicare, not related to US Medicare. In these countries, people call it free healthcare, even though it's actually paid for through taxes. The advantage is that it's simpler and usually cheaper overall because the government negotiates prices for everyone. The downside is that sometimes people pay slightly higher taxes to fund it. So yes, when people talk about free healthcare in other countries, they're usually describing something very much like the single payer system we've been talking about. Okay. So, can see where it would be difficult because you sounds to me that sounds fine that you pay taxes for free healthcare essentially. I know there are drawbacks people talk about, right? And I know that in America people would be like taxes, hell no. I'm down with taxes. So I just anyway, this was interesting.